We know that the La Hoquita Health Center and the Aruca Health Center have been activated as advanced medical posts. Can you tell us about that?
Yes, so we activated 2 health centers and also 2 other shelters. So we have a total of about 4 locations for the people of La Hoquita, Talparo. They have been particularly badly hit. So Aruca Health Center, La Hoquita Health Center, a couple of the schools, and 1 shelter. We have doctors there, nurses there, pharmacists. Many people are being treated, especially those who are on, who have chronic conditions like diabetes, hypertension, who would have lost their medication. We have actually brought in medication for them. We are also providing them with some psychological counselors because in a disaster like this, one can't forget the mental side of it. So we want to take care of them both physically, physically, and mentally.
Can you tell us how prevalent this is in terms of people coming into these health centers?
Well, there has been a steady flow. They have not been overwhelmed, and we are triaging them there. And the cases that could be handled there, we handle them there. And the ones that need secondary or tertiary attention, we send them to either the Arima District Health Facility or to Mount Hope. The biggest challenge we are having is with the Sandy Grande Hospital. Whilst the hospital has not been affected by floodwaters, people can't access the facility because the surrounding roads are flooded. So that's a bit of a concern, and we are trying to get patients who need to get to the hospital to the facility, but the facility is intact. Other parts of the country we are paying attention to. We are paying attention to the Couva District Health Facility, Princestown, and the Superior Health Facility. They will all stay open 24/7 because Central Trinidad, including places like St. Helena and so on, Carapichaima, a lot of those places are underwater, and they can access care at the Couva District Health Facility or at Eric Williams if they can get there.
Minister, with this situation being as bad as it is, the Prime Minister said it was a national disaster.
It is.
How can people leave their homes, as the Minister of National Security had said, to go to these facilities? If somebody gets ill, what can they do?
Well, what we are doing, we are trying to have a couple staged areas. So if we get them, if we can pluck them from their homes by, let's say, boat and get them to high ground, that's what we are doing, and then transport them by overland ambulances or other vehicles. But there's another side to this that I want to start to alert the public to, and that is water safety. If you can avoid going into floodwaters, please do. I mean, if you have to get into floodwaters to save your life or save property, well, yes, you don't have a choice. But we have to be aware of floodborne diseases like leptospirosis. We don't want people drinking or using contaminated water. Boil your water or use bleach. The backs of bleach bottles have all the instructions of how you could use bleach to purify water, especially if you have to use water for children and babies to mix formula. Food safety becomes an issue now, so we want to caution people, pay particular attention to how you're cooking and preparing your food and what type of water you use, and don't use vegetables and so on that have been contaminated by floodwaters. The last issue, or another issue we have to pay attention to, once things start to go back to normal, will be post-traumatic stress. People are going to be stressed out by this. And in La Hoquita today, we have actually had psychological counseling for some people. So this is something that the Ministry of Health, via the RHAs, are going to pay attention to once more and more people come into the centers as the floodwaters subside.
And this is something that we'd have to monitor. as
Yes.
the days
Yes.
progresses, because
Yes.
as the Met
Especially
Office
for
has said.
people hard hit like people in Caroni, Bamboo number 1 in my constituency has been particularly hard hit. I tried to get into Bamboo today, but I couldn't because police wouldn't let me get in there. But I've been in contact with people who I know in Bamboo, trying to get sandbags to them because I just physically could not get it. So people in Caroni, Central Trinidad, Bamboo number 1, and other areas that have been hard hit, they are going to need a lot of psychological counseling in addition to physical help.
Yeah. Minister, I just want to find out, have there been any serious cases yet as it relates to health and people?
I haven't heard of any serious cases as yet. I know in La Hopita we had one pregnant lady that we had to see about, but nothing to be unduly worried about as yet. But the weather pattern continues for another 3.5 days until Tuesday. We keep preparing for the worst, and all systems as far as possible are up and working. But as I said, Sandy Grande is a bit of a concern because the facility is good, but just the surrounding roads for access is issue out.
Are you concerned, as you mentioned, 3.5 days, that the possibility of the health ministry being able to be effective for the next 3.5 days in terms of resources?
Yeah, we are going to be effective. Our drug supply at C40 is intact, which is a very good thing. They have not been affected. CARFA, the Caribbean Public Health Lab, has offered all their assistance in case we need to do testing of water samples and so on. So I think we're in a good place, but we have to be prepared for the worst. And people can help us by taking common sense approaches. Don't put yourself in danger. Stay out of the floodwaters so you can avoid floodborne diseases.
And one of the questions that was asked, if the rain continues over the weekend into Monday morning, and we are being told to not, leave the house, would there be any repercussions possibly if we don't go to work?
Well, that is something we have to look at when Monday comes. But I think the priority now for people is to protect themselves,
yes,
protect their lives, and protect their property, protect their loved ones. We'll see about work on Monday morning, but the priority now is protection of life, of property, life, and limb.
Minister Deyalsingh, you're also the Member of Parliament for St. Joseph.
Yes.
Can you tell us how things went there?
So I did a tour of the constituency this morning. The constituency, except for Bamboo number 1, escaped relatively unscathed. Bamboo number 1 is the area that was most hard hit. And as I said, I tried to get in this morning, but the police just would not allow me to get in because the road was closed. But we are in contact with people there. The councillor, Asif, did an excellent job last night. He got about 400 sandbags in for the people. I have tried today to get in another 200 to 300. They need sandbags now. And we are trying to open up other centers in Bamboo number 1 as shelters. Hopefully, I should be allowed in tomorrow, and I will be on the road tomorrow. But today, I did visit places in the constituency that normally flood. Bangladesh did not flood. I went to Mount Lambert, no serious flooding. We did have a couple landslips at Kaiban, my tower. We have a serious issue with one house in Mount Dore, which we are addressing.
All right.
So that's it as far as the constituency is concerned.
All right. Thank you very much, Minister of Health, Terrence Deyalsingh, also the Member of Parliament for St. Joseph, telling us some of what the ministry is doing to ensure that the health of the citizenry is taken care of. Remember that both the La Hopita Health Center and the Aruca Health Center have been opened as advanced medical posts. The Aruca Health Center is located at the corner George Street and Golden Grove Road in Aruca. And the La Hoquita Health Center is located at Arthur Murray Crescent, La Hoquita Phase 3. A concern about the Sangre Grande Health Facility because of the flooding around the building, not necessarily in the building, and that is something that the Ministry of Health would be working on.